should ask, what do you do to screen your egg donors above and beyond all of the, I would say, obvious drug testing and psychosocial evaluation and assessment of overall health? Does a genetic counselor meet with the egg donor, and if he or she does, specifically what tests does this clinic feel is necessary? Because clinics vary with regard to what they think needs to be evaluated. And really, when you choose an egg donor, among the many things you're choosing is half of the genetic component of the children you'll have. So genetics is really, really essential to not only evaluate, but to discuss and to understand. Infectious disease testing is, of course, critical in the process. And you also need to know that the donor you're choosing is committed and dependable and can be relied upon to do all the things that we as the doctors are going to not only ask but need her to do. Take lots of injections, show up for lots of ultrasounds, and to be able to perform functionally despite all the many things that go on in the lives of women in their 20s that can sometimes be distracting. The clinics also may or may not give you the ability to look at pictures. That's essential as a minimum for most people with whom I work. Many of my patients meet their donors. They may meet them through Skype. They may meet them through emails or phone calls, but more often than not, they actually meet them and spend some time with them. And so meeting a donor, looking at the donor's baby pictures, looking at the donor's siblings' babies' pictures, just looking for things, and different things mean different things to different people, but I think being given the access to make that own assessment is very empowering and much, much more comforting than the idea of being anonymously or in some instances almost randomly matched to someone based on something as cursory as height or weight or eye color. You also should ask and consider whether the donor's donated before. An experienced egg donor who's 26 or 27, whose records should be made available by the clinic to you to know, well, the first time she had 24 eggs and 22 fertilized, and we put in 2 embryos, and they got twins, and they froze 16. Those are really very meaningful and very, very predictive to future cycles. And you might be well advised to choose a donor who's maybe a little bit older, but with a track record, basically an egg donation resume or a performance sheet, over somebody who may be a few years younger, but possibly less experienced and possibly less proven. Again, all of the decisions that you should think about making and that your caregivers should be guiding you toward should be focused on maximizing the effectiveness and the efficiency and the safety of the pregnancy that you're achieving, so that if you create the highest grade embryos possible, you can often put in 1 embryo and get a single pregnancy and potentially avoid a riskier twin pregnancy, especially if twins is not what you want. But to be able to do all of these things without compromising the likelihood of success.